Well, on the front page of USA Today, lead article, front page is about 25-30% of the front page, says mammogram risk and benefits. And let's see here. The results of 10,000 women. If 10,000 women get an annual mammogram after the age of 40, there is 6,130, 61% give false positive results. 61% get false positive results. Okay? Let's see. Women who are treated unnecessarily, with the full treatment, radiation, surgery, chemotherapy is 36 out of the 10,000. Unnecessary biopsies are 700. Breast cancer diagnosed, 190 out of the 10,000 mammograms. Breast cancer deaths are 30. And lives saved due to mammograms, ones who are diagnosed correctly and blah, 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 and they get the maximum treatment. Of the 30 deaths and 190 diagnosed, there are 5 lives saved. 5 lives saved each year. Now, I don't discount the 5 lives that are saved. Believe me, that's extremely important. But there's cheaper ways, safer ways to do it. Okay, we're talking about high-resolution ultrasound, no radiation, no risk of creating breast cancer. And then we know medical doctors, and this is from the U.S. Department of Health and Human Services Office of Inspector General, the Inspector General for the Department of Health and U.S. Health and Human Services. And we're looking at, they say, this came out, 2011, they say that each month, medical doctors kill 15,000 seniors over the age of 65 by putting them into hospitals for unnecessary screening tests, such as mammograms, and colonoscopic exams and biopsies and so forth, and endoscopic things put down their throats and up their other end and so on. And we're talking about colonoscopic exams, endoscopic exams down the throat. They kill 15,000 a month. These are people who shouldn't have died, right? And that comes to 180,000 a year. And so we have a problem here. Okay, we have a huge problem. And I've been yelling about the mammogram thing, for 25 years. And the headline here of this article in USA Today is, in shift, cancer society advises fewer mammograms. Where before, oh my gosh, it was the thing that ended all things. You have to appreciate that cancer, if those cancer deaths were added to the 15,000 a month over the long haul because of the mammograms, it could be, instead of 15,000 a month, 20,000 a month. Okay? And so we have to look at this with a special eye. Okay? Medical system and cancer. It's certainly not genetic. It's self-inflicted. And the first clue came out in April of 1912, an article published in the Popular Mechanics magazine about a trace mineral called selenium that could significantly reduce the risk of breast cancer. Now, it was published in Popular Mechanics magazine because the medical journals would not publish it because selenium was potentially toxic and is also thought to be an essential nutrient, which wasn't confirmed until like 40 years later. But it was this toxic thing, and it was a nutritional thing, and they didn't want to put it into a medical journal, so it was published in Popular Mechanics magazine. Well, the same study was repeated and published in 1998, I think it was the Annals of Medicine, and got the same results. This is Dr. Larry Clark from University of Arizona School of Medicine. Okay? And so again, cancer, including breast cancer, is not genetic. It's self-inflicted. It's not pollution. It is how one eats, how one cooks their food. The Harvard Nurses Health Study, 90,000 nurses over 20 years, they found that if women cooked and then ate the meat that was cooked very well done, where the fat was browned or burnt, it increased the risk of breast cancer by 462%. It was a front page story in every big newspaper in America in 1998. But there wasn't one doctor say, hey, okay, ladies, here's an email. You got to stop cooking your food well done. I want you to cook your meat medium rare if you're going to eat meat. But they never did that. Okay? And so how many people supplement? Well, one of the things that I've done is sue the FDA 9 times in federal court, prevailed and won all 9 times. One of them was supplementation of selenium can significantly reduce the risk of certain cancers, including breast cancer, colon cancer, liver cancer, and so on. And this is one that is a claim I can make because I won over the FDA in federal court. And so these are the sort of things doctors should be talking about, but they don't. And so I'm urging women to become a student of this information. Get a hold of the book Epigenetics. I go into great detail here how to prevent cancer, how to protect yourself from cancer, how to do the best you can to support your immune system so your own immune system can prevail over the cancer, right? Get the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Get a hold of the DVD, which goes into great detail, my lecture on that subject in the book Epigenetics. The DVD is called Somebody Needs to Go to Jail, and they should go to jail for all the terrible things they do to our seniors. And then the CD is called Public Enemy Number One. Okay, Public Enemy Number One, of course, the Untouchables, the FBI, all these government agencies go after these people. They're horrendous criminals that cause huge problems in society, cause many deaths and terrible injuries and terrible crimes. Well, guess what? The crimes perpetrated by the medical system are far worse than anything that the mafia ever did. Far worse, because everybody's involved. The mafia usually did crimes against their competing families, the mafia families. But it didn't boil over into the general population. So that's why doctors kill more people than the mafia. Doctors injure more people than the mafia. Public Enemy Number One, my new CD. Public Enemy Number One, my new CD. My DVD is Somebody Needs to Go to Jail. And the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. We'll be back with Dead Doctors Don't Lie for these messages.
Do certain foods cause you to bloat or experience gas? Do you wake up in the middle of the night with heartburn? Are you forced to sleep on piles and piles of pillows to cut down on heartburn? Have you been diagnosed with acid reflux or gastroesophageal reflux disease? If any of these describes you, then you've got digestive problems. I was awakened with heartburn almost every night for over 20 years. Then I heard Dr. Wallach and realized all of the antacids I'd been using were actually part of the problem. My stomach acid wasn't too strong, it wasn't strong enough. So I started taking the ultimate enzymes from Longevity. Now all of the heartburn, belching, and bloating are gone, and I can sleep through the night without piling on the pillows. And I'm back to eating the spicy foods I love. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a bit about medical fraud, as I've got a story here I got from Natural News with the headline reads, Depression Drug Medical Fraud, Vast Majority Prescribed Dangerous Mind-Altering Drugs Don't Even Have Depression. This is a new study that was published in the Journal of Clinical Psychiatry. And they say it indicates that 2/3 of people who've been prescribed antidepressants, such as these SSRIs, the selective serotonin reuptake inhibitors, do not display classic symptoms of major depressive disorder, commonly known as clinical depression. They say 69% of the people taking these drugs didn't even have the symptoms to be prescribed the drug. They say they're also prescribed for other mental disorders, including generalized anxiety disorder, social phobia, obsessive-compulsive disorder, panic disorder, and researchers found that about 38% of those taking the drugs did not meet the criteria for those conditions. They say the SSRIs are the most prescribed class of drugs for treating depression and other psychiatric disorders. And the authors of the study wrote, quote, many individuals who are prescribed and use antidepressant medications may not have met the criteria for mental disorders. Our data indicate that antidepressants are commonly used in the absence of clear evidence-based indications. Between 1988 and 2008, antidepressant prescriptions increased almost 400%, with now 11% of Americans now taking these drugs regularly. And they asked the question, why are these drugs being overprescribed? According to Dr. Howard Foreman, he is a medical director at the Addictions Consultation Service of Montefiore Medical Center. He is quoted as saying the answer might be that temporary periods of mental stress are being misdiagnosed as clinical depression. And he goes on to say we all experience periods of stress and periods of sadness, periods of self-doubt. These don't make us mentally ill. They define us as human. Also points out that although psychotherapy might be a better way of treating these conditions, he says there's, quote, roadblocks involved, including cost, scarcity of qualified therapists, and time demands of those experts. Official U.S. guidelines for diagnosis of depression are when a person has 5 or more depressive symptoms over a 2-week period, most of the day, nearly every day. The symptoms of clinical depression range from depressed mood to thoughts of suicide, might also include the lack of interest in normal activities, changes in weight or appetite, insomnia or too much sleep, restlessness, fatigue, guilty feelings, and problems with concentration or decision-making. They say the use of Prozac and Serotonin actually doubles the risk of suicidal behavior in young people. And, gee, wasn't all of those people that shot up the schools and stuff, weren't they all on those drugs, and they were all young people, and they know that it causes these kind of... Why were they even prescribed these drugs, Doc?
Well, because it hooks the patient to the psychologist and the psychiatrist. That's the bottom line here. You have to come in and get the prescription, right? Otherwise, it can't be under control. And then, of course, they continue to get worse because that's not the answer to the problem. Actually, clinical depression is actually a nutritional deficiency disease. We have time, we'll get into it. It's a nutritional deficiency disease. I know the exact nutrient. There's significant, there's some of the biggest double-blind studies ever where there's thousands and thousands of people involved was done on this one nutrient that's missing when you have clinical depression. And then, of course, the psychologists and psychiatrists don't want to miss a paycheck. Every one of these people who shot up the theaters and schools and churches and public places should have been institutionalized 2 years earlier. But the psychologists and the psychiatrists didn't want to give up their weekly paychecks. So let's throw one more in. Let's double the dose. And they keep playing around like that because they don't want to give up the weekly check. Well, here's the deal. Whenever something terrible like this happens, the psychologists and psychiatrists always disappear. You notice there's never, ever been an interview with any of the psychologists who take care of these people that blow up everything and shoot up everything. They all disappear under the refrigerators like cockroaches when you turn on the light. Okay? They should be put in jail, just like a bartender. When they keep giving drinks to somebody who's obviously intoxicated, that person leaves, they go kill somebody in a car, vehicular homicide. Guess who gets put in jail also? The bartender. When a sick person who is on psychologically prescribed medication kills people, the psychologists and psychiatrists should also be put in jail. That ought to stop all this. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Sacramento, California. And Carol, you're on with Dr. Wallach.
Oh, Carol, you're on the air.
Hi, Dr. Wallach.
Hi, how can we help you?
You are so brave. I've been wanting to talk to you for a long time. You know, I don't know. I think it's probably some type of Morgellons, but there seems to be so many different things with that. It just doesn't seem to be one type of infection. And I'm getting more energy. I've been on the Healthy Start Pack for about a week and a half. You know, I can actually get up and take care of things. But I have something so bad, the medical community has totally bankrupted me. And
okay, well,
so terrible.
Okay, so, you know, you're telling me you feel terrible. The medical system has bankrupted you. What was their diagnosis? What did they diagnose you with?
Oh, well, they diagnosed me as delusional parasitosis.
Okay, delusional what?
Delusional parasitosis.
Okay, so they say you think you have parasites, but you don't.
They won't even consider it. They won't even check anything out that I've said. Nothing.
Okay, well, let me ask you some questions. What symptoms drove you to go see the doctors?
Well, I was like sick and fluish, and then I started noticing my little granddaughter was getting ill when she was around me, and I've been separated from my family.
Stop a minute. Is your granddaughter from a daughter or from a son?
From a son.
Okay, so
but she's like more
your
like
son is the father
like
of this.
Me.
Okay, that's not the question. That's not the question. The question is, this granddaughter is the child of your son.
Yes.
Okay, now, let me ask you a question. How many children do you have?
Two.
And are they both sons?
No, a daughter and a son.
Okay. Do either of them have any skin problems, any eczema, dermatitis, psoriasis, or rosacea?
Well, we've always had skin problems, like the acne type of thing, but I have something that is definitely contagious, and nobody will even consider it.
Well, just tell me what it is.
Well,
is it on your skin?
You know, I think it's, well, I've asked somebody, and they said they've never heard of it. Most people have never heard of humans having it.
No, you're not answering my question. We're not going to get anywhere unless you answer my questions. Okay? I don't care what anybody else said, unless I ask you. So, what does it look like? Do you have, like, a rash? Do you have any itchiness? Does it come and go?
It started with rashes. I've had some bad skin lesions, and usually I don't, because I take, good care of my skin, but there's something on my skin, and there's something, there's like looks like dust coming off of me, because there's got to be something. People cough and gag, and some people get sick.
Okay, stop. Okay, now, did you ever have any bowel problems? Constipation or diarrhea? Yes or no?
Well, just a little bit. I've been following your program.
We got to run to one of these message moments. So collect yourself, because I just want you to answer the questions. We'll be back after these messages. Okay, Doug, let's go right back to California and Carol. Okay, did either of your sons have asthma?
No.
No bronchitis? No bronchitis, no asthma? What about bowel problems? What about bowel problems? Any constipation, diarrhea?
My son has bowel problems. He has constipation and a megacolon, and the doctors wouldn't listen to that, and he wouldn't listen to me.
Stop there. We already know what your problem is. Okay, this is a Shar thing. Okay, Shar, what's Carol's problem, and what does she pass on to her kids?
She has a gluten intolerance.
Absolutely. Okay, and what triggered you? What told you that?
The constipation, the diarrhea, anybody that's got alternating constipation and diarrhea. And there's one other thing, too, that causes hairy skin, which is a pellagra, which is a niacin deficiency.
Yeah, you know about that. And then what about people who are losing their hair and all that kind of stuff?
Well, it can be from that, too.
Well, lack of nutrition. And what happens to your absorption ability, your efficiency of absorption when you have a gluten intolerance?
Well, when you have an absorption problem, because it scars the intestinal wall and it tears it all up, and you can't absorb any nutrients in the food, which is very little anyway, and then you're going to come down with all kinds of different diseases based on whatever nutrients.
And you met one gal in Canada who had gluten intolerance. How many diseases did she have?
22 different diagnosed diseases by different doctors.
Okay, so here we go. So here, Carol, I have to ask you one more question. Char's exactly right. Now, how much do you weigh, Carol?
150. Oh, well, not actually, probably closer to 140.
Okay. All right. So what I want you to do is get rid of all the bad stuff. No fried foods, no processed meats with nitrates and nitrites, no oils. That means no microwave popcorn, no theater popcorn, no olive oil, coconut oil, margarines, mayonnaise, salad dressing, cooking oils. Absolutely no gluten, no wheat, no barley, no rye, no oats. And it's in everything. So I urge you to get a hold of that CD called Serial Killers so you can learn all the hidden places you're going to find gluten. And then for a supplement program, I want you to take 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. A full dose of everything twice a day in those boxes. A full dose twice a day. Okay, so it takes 2 healthy brain and heart packs per month. I want you to get a hold of the de-stress capsules. That will be 3 of those twice a day. That's 2 bottles a month of the de-stress capsule. That's for brain metabolism. And then also, I want you to take what we call immortalium. I want you to take 3 of those twice a day. It's 2 bottles a month. And the whole purpose here is to encourage repair of everything in your body, including your skin and your bowels and your other organs and tissues in your brain and so forth. It's going to take a lot of work here. And I want you to eat a minimum of 6 to 8 eggs a day. They can be soft scrambled in butter. They can be soft poached with a soft yolk or soft boiled with a soft yolk. Don't fry anything. You cannot cook anything in oils. You cannot use oils in any way, shape, or form. call us every 2 weeks and let us know how you're doing. And I think you're going to be one of our poster girls because I've seen so many cases like yourself, and so has Shar, and it's amazing what happens when you get off of gluten and you get on the 90. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's stay there in California and head to Jelena. You're on with Dr. Wallach.
Hello, Jelena. You're on the air.
Hi, thank you. I'm returning customer, however you would like to call me. I called 3 weeks ago with a spasm, tumor, high blood pressure, weight loss, and I was taking ASAP, Beyond Tangerine, 2 scoops, 2 times EPA Plus, 2 times EPA Ultimate, 2 Selenium, 3 Ultimate a day, 3 Beyond Tangerine, 5 glucose, and 1 cardio, and this is 3 times a day.
Mm-hmm.
I have started having reaction to tangerine that I mix up with water. After about 10 days, I started burping constantly and started having acid
Okay, now stop there a
reflux.
minute. Stop there a minute. Are you taking this stuff on an empty stomach or with your meals?
With a meal.
Okay, good. Now, you want to split it up. Don't take it all at once. That's a lot of stuff. How much do you weigh?
200 pounds.
Yeah, well, that's why you're taking so much, because this goes by body weight. And so make sure that you split it up. And I would split it up even more. I would take a third of the calculated dose at breakfast, a third at lunch, a third at dinner. Certainly don't take it all at once. You want to take it halfway through your meals. In other words, take it after you've eaten half your food. That way you got something in your stomach. And, Shar, what would you do to help Jelena with her digestion and reflux and burping? What would you give her?
I would give her some peppermint oil and hot water.
Okay, some peppermint oil. We have our peppermint oil from our Ancient Legacy aromatherapy oils. Put 4 to 6 drops either in an 8-ounce cup of hot water or even an 8-ounce cup with some peppermint tea would be good, and put that in there and sip on that, and that'll stop the burping and bloating right away. Within how fast have you seen it happen, Shar?
About 10 seconds.
Yeah, it happens in 10 to 30 seconds. It's quite quick. You'll get relief from that. And then another thing, if you're not taking enzymes, I'd also have her take what?
If she's not taking enzymes, you mean? I would have her take enzymes.
Well, there you go. I'd have her take the Ultimate Enzymes, which has stomach acid in it. When people burp and that sort of thing during supplementation, it could be 2 things. Number one, you have plenty of yeast and bacteria growing in your stomach, which means your stomach's not sterile. You have to have your acid environment in your stomach to keep your stomach sterile. And if it's not sterile, yeast and bacteria will immediately generate gas, and that can cause belching and burping and bloating. But also, some people are sensitive to the fish oils, okay? And so what I would do is take the fish oils at 1 meal. Just take the fish oils as 1 meal, the EFA pluses, and see if that's the only meal you're burping at. It might be the fish oil, and we have to convert to all EFAs, which are from flaxseed oil. And so there's a little bit of fish oil in there, too, and if that still does it, then we might have to move you to the evening primrose oil called multi-EFAs. But just only take the fish oil at 1 meal. Don't take them all, but just take like 3 or 4 or 5 or 6 at 1 meal and see if you're burping with, and the burping may be due to the fish oil, not the BTT. Usually burping doesn't happen with BTT, but it can get some people with the fish oil. So you have several things to do here. Split it up more, a third of each dose at breakfast, lunch, and dinner. Take your EFA pluses at 1 meal, 4, 5, or 6 of them, so you get some sense if that's the only meal you're burping in, it's the fish oil, not the BTT, and then you know what to do. Okay, now, one question. Did you lose any weight in these couple of weeks?
Unfortunately not.
Okay.
I also wanted to
Wait a minute, stop. If you're not losing weight, then we have another problem here. Are you gluten-free?
I'm not eating anything gluten.
No
I'm
wheat,
from
no barley,
Europe,
rye, no oats?
Mediterranean.
No bread,
I
no
eat
pasta?
rice. No bread.
Okay. All right. Okay, one more thing. Go ahead. You said you had one more thing. Tell me.
Right. I didn't finish it the last time. I wanted to mention that my blood pressure goes over 200, and it goes down to 170. In these 3 weeks, I was hospitalized once. My ankles are swollen. I'm constipated, and I forgot to mention initially that the MRI shows that I have a bone spurt all the way down my spine.
Yeah, okay, so stop there. Yeah, what's her problem here, Shar?
She's got a gluten problem.
got a gluten problem. You're not absorbing efficiently. You may be absorbing a little bit, but you're not absorbing efficiently. So somebody in your house, whether it's the dog, the cat, the bird, the fish, man, spouse, woman, mother-in-law, grandma, kids, somebody in the house is bringing gluten in or has gluten in. You're getting cross-contaminated. The reason why you have bone spurs is you have a raging calcium deficiency. And it's going to take some time to rebuild that. It might take you a couple of months to rebuild that, 60 to 90 days. The bone spurs will go away. They just sink back into the bones. You don't need any surgery for bone spurs. But they will go away. And so, but you're going to have to be a detective and look around the house and see who is bringing gluten into the house. I hope you're not a baker and you're dealing with baking bread and cookies and all that kind of stuff, either at a volunteer place or a restaurant or something, or a factory. You can't be around that kind of stuff. Call me in another 2 weeks when you make these adjustments and tell me what you learned. Okay, Doug, how much time we have?
We got time to get to one more. Let's head to Cindy in North Carolina. You're on with Dr. Wallach.
Okay, Cindy, you're on the air.
Hi, Dr. Wallach.
Hi.
Great fan here.
Well, thank you. Okay.
I've only known about
fun.
you 4 months, but I think I may surpass any one that's going to tell everyone about you.
Okay, well, super.
All right,
how much
I have
you pay,
a
dear?
granddaughter.
Oh, this is about your granddaughter. Okay.
Yeah, she's 5 years old, and she was adopted. We adopted her from birth. She came home on methadone. Since then, we have just recently got her off of 2 seizure meds, but she still has remaining issues with her bowels. She can't train because she doesn't feel the sensations. She's on not triliptol. That was her seizure med. She's on a Prevacid dose, anti-acid meds. She's on so many things that I really want to get her off of, but mainly.
Yeah. How much does she weigh? How much does she weigh?
Right at 40 pounds.
Okay. All right. Well, PPIs are the worst possible thing for her. And again, Char is exactly correct. When you have a situation like this, you want to give her peppermint tea. There's no caffeine in it. It's an herbal tea. And you want to give her a couple of drops, say 2 or 3 drops of our peppermint oil in that herbal tea and let her sip on that starting 5 or 10 minutes before each meal. And let her sip it through the rest of the meal. That's going to be her primary drink, okay, is a peppermint tea with the peppermint oil added to it, 2, 3 drops before and through each meal. And then so she does have diarrhea. This is because she has what, Char?
She has a gluten intolerance.
Yeah, absolutely. So she's got to get off of gluten. You got to get off. Everybody in the household has got to be gluten-free, the dog, the cat, the bird, the fish, grandma, other kids, and so forth. And we'll go over her program again, what she should have at 40 pounds after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the 90 for Life Crusade. And Doug, let's go right back to North Carolina and Cindy. Okay, so basically what I want you to do is get your granddaughter a healthy start pack, one healthy start pack. Cut it in half, so one healthy start pack is going to last for 2 months. And I want you to give her a half a dose a day, but I want you to divide that half a dose in half so she can effectively get a quarter of a dose at breakfast and a quarter of a dose at dinner time. That'll be a teaspoon and a half of the OsteoFX Plus at breakfast and dinner, 1/2 of a scoop of the BTT 2.0 NutriCrystals at breakfast and dinner. The EFA Pluses, I would go ahead and give her one at breakfast, and I'd give her one at breakfast. Let's just start there. And then it's imperative she stays away from all the bad stuff, the gluten, et cetera, et cetera, et cetera. And then call us every 2 weeks and bring us up to date, and we'll walk you through this. But you want to gradually wean her off of some of this medication. She's already off this anti-seizure medication. That's a good thing. Make sure she's eating plenty of eggs every day. Keep her away from sugar and no gluten. That means cereals and oatmeal and all that kind of stuff. But no sugar, no juices, no juices, no juices. Okay, Doug, we got time to start another one?
We certainly do. Let's head to Germany. And Gottfried, you're on with Dr. Wallach.
Okay, Gottfried, you're on the air.
Yeah, I called some time ago, and you said I should call back in 2 weeks' time. But because of my eyes, my two eyes are blind. I can't see. So I just want to ask you whether I can take aspirosis of the skull and circulation products.
Okay, you're talking about some more circulation into your skull, and osteoporosis might be squeezing that optic nerve. I remember that. And so, yeah, I mean, what you can do is take an extra ounce. What do you weigh, Gottfried?
160.
Okay, then I would go ahead and take 3 ounces of the osteo a day, one at breakfast, one at lunch, one at dinner, or one at breakfast, one at dinner, one at bedtime, whatever is more convenient. And then, Chart, what would you give him for better circulation?
I would give him Ultimate Daily, Cardio FX, and Cardio Sticks.
The Ultimate Cardio Sticks, exactly right. So go ahead and take 3 of the Ultimate Dailies twice a day. That's 1 bottle of Ultimate Dailies a month. You want to take, as Char says, the Cardio FX. I'd take 3 of those twice a day. That's 2 bottles a month. And the Ultimate Cardio Sticks, I would go ahead and take 1 of those at breakfast, 1 at dinner time. I mean, if finances are not a problem, you could take 3 a day, 1 at breakfast, 1 at lunch, 1 at dinner. They come in boxes of 30, so you have to order at least 2 boxes of 30 a month. If you want to go to 1 with each meal, that would be 3 boxes. But I think you can accomplish the proper circulation having 2 boxes of 30 of the Ultimate Cardio Sticks, and that way you'll be able to take 1 at breakfast, 1 at dinner time. Stay away from all the bad stuff. That includes carbonated drinks, which makes, even if you think they're safe, like things like ginger ale and club soda, sparkling water, can't have anything carbonated because it neutralizes stomach acid and significantly reduces the ability to absorb minerals. And so in addition to that, you want to just don't even go into a building where they have gluten. That means dog food, cat food, bird food, fish food, bakeries, restaurants where they pride themselves on good bread and that kind of stuff, pasta, spaghetti places. You got to stay away from all those places where gluten is a big feature. And nobody in the household can be eating gluten and bring it into the house or have in the house because of cross-contamination in the laundry, the food preparation surfaces, the beds where people sleep, the couch where people watch TV, and all that kind of stuff. I mean, if you have a dog and they've been eating dry dog food made out of grain for years, the rugs in the house are just full of this gluten dust, and you walk barefoot through there in your socks, you're going to be walking through a dust bowl of gluten. So all this has got to be cleaned up, and watch it. And don't forget the vision effects. Don't forget the extra auric points. Get your auric points up above 100,000 a day. And then call us in another 2 weeks and let us know if you're seeing any progress. Okay, Doug, how much time we got here?
We're just about out of time.
Okay, well, thank you, sir. I will remind everybody to get my new book, Prepare, the Prepper Survival Bible, and a new book, Epigenetics, the Death of Genetic Disease Transmission. Char, I want to thank you. You did a great job again today. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
The antioxidants found in many fruits and vegetables are known to help support and promote good health. Research has also shown that dark chocolate, once known as the food of the gods, is rich in healthy nutrients. In fact, dark chocolate is higher in antioxidant content than any other food. Youngevity has combined a proprietary blend of velvety rich dark chocolate with whole fruit pulp and whole fruit juice extracts from mangosteen, goji or wolfberry, acai berry, and cherry, along with vitamins and minerals. producing a smooth, rich, delectable concentrate called Cocogevity. It tastes so great, I sometimes drink it right out of the bottle or pour it over ice cream. Cocogevity is highly bioavailable, meaning your body will absorb and make use of all of these healthy nutrients. If you'd like to learn more about nutritional supplementation, call your local longevity associate and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Longevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. When those aches and pains in your knees, elbows, hands, shoulders, and back crop up, reach for Longevity's CM Cream. Put CM Cream on a Q-tip and put it in your ear canal for relief from headaches and sinus pressure. A topical temporary relief from minor aches and pains of muscles and joints associated with arthritis, strains, sprains, and simple backaches. Why take aspirin or non-steroidal anti-inflammatory drugs that can cause stomach bleeding and liver damage? Just apply CM Cream liberally to the affected areas, and within 20 minutes or so, you'll have relief from those nagging minor aches and pains. You'll feel better for up to 4 to 5 hours. So the next time you have achy joints or muscles, do what I do. Reach for CM Cream for relief. And for systemic relief, reach for CM Plus capsules. If you'd like to learn more about nutritional supplementation, call your local longevity associate. And don't forget to ask about home-based business opportunities.
In recent years, several studies have discovered the health benefits of drinking coffee. Longevity has now taken it a step further with an entire product line of healthy coffees from Longevity's JavaFit selection of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium hand-selected Arabica coffee beans grown in the finest regions of Latin America, all carefully roasted, creating a delicious, rich, full-bodied flavor. Try JavaFit's Immune Plus, a full, robust coffee blend combined with the immune-supporting benefits of echinacea and the full-spectrum daily requirement of vitamins and minerals. Boost your immune system every day with JavaFit's Immune Plus multivitamin coffee. Available in 30-count single cup or 24-count single pot packs. Contact your local Longevity distributor to get Javalution coffees. And don't forget to ask about the home-based business opportunity.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable vegetables, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.